Mr. Chairman, committee members, thank you all for having me today. I'm Scott McCown, and I'm the director of the Children's Rights Clinic at the University of Texas School of Law, though I'm here as an individual, not in an institutional capacity. I want to thank the chairman, and this is a sincere thanks, for two things. First, he's invited me to testify, even though he knows I have some reservations about the bill, and so that's very fair, and wants to air those. And second, his staff has really worked with all the advocates on a committee substitute, and I think that committee substitute goes as far toward what I would do as he's willing to go, but not as far as I think we need to go.
We got another one coming.
All right. So I'm testifying on the bill today and as a resource. And let me say something at the outset. Every good thing that Wayne Carson has accomplished, he has done with the state having case management. So all the good things he's done has been done with the state having case management. And every good thing he says he wants to do, all can be done with the state having case management. Private contractors can work with families. They can be charged with coordinating services. They can be given approvals. We can hook them up to our data system. So everything he's done, everything he wants to do, we can do with the state having case management. Now let's talk about what case management is. The way it would work under Senate Bill 11 is that whenever a court names the state as the conservator of the child, the state would delegate its responsibility by contract to that single source continuum contractor. That contractor would employ various subcontractors. And in the name of the state, beyond the state's control, the general contractor would then be in charge of prosecuting this civil court case and making decisions about whether the child goes with Aunt Sally or stays in their foster care. And this is a managed care organization that is going to be making money or losing money based on the decisions it makes. And that is a serious conflict of interest. And that is what public case management is all about, is making sure that what happens is in the best interest of the child. It does not help that the state's attorney continues to represent the state. The state's attorney, this is a civil case, the state's attorney looks to the department, to that CPS voice, as Andy said, as to what legal position are we going to take. They don't have the knowledge, they don't have the expertise, and they have extraordinary high caseloads. They haven't met the children or the families. They are in no position to provide case management. They take their direction from the department, and under Senate Bill 11 would take their direction from the private nonprofit, this managed care organization with this conflict of interest. Now, the states that have done this, on balance, have not gotten better outcomes. So if you look at the data across the country, we haven't gotten better outcomes. But it's cost a huge amount more money. And why does it cost more money? Because you have a lot of one-time process in building this new case management function, and because removals dramatically increase. This is an extremely important point. Removals dramatically increase when you separate your investigations and your conservatorship function out. So you have a whole lot more kids, you pay a big one-time cost, and then your ongoing cost increases. Well, why does your ongoing cost increase? Because you're dealing with an oligopoly. There are very few organizations that can do this. And once they've negotiated that initial contract, and you have shut down your public system, and it's gone, then you're at their mercy on pricing. And so your costs are going to go out the roof. Now, why would I care as a tax and spend liberal about that? I would care because that's money that we don't have for investigations. That's money that we don't have for prevention. And finally, let me say a word about the court case and about transformation. The day you pass Senate Bill 11, you are saying to your current workforce, you folks are out of a job. We don't know how fast or when, but you've got no job. So all of the efforts in the legacy system, which is going to exist for years under any scenario, all those efforts to improve it stop, and all the turmoil that you're trying to eliminate in your workforce continues. So I think we're making a serious mistake that we don't need to make. We can achieve Wayne's outcomes without the transfer of case management.
Senator Schwartz.
I really appreciate you being here today. I greatly respect your input, and some of the things I just, quite frankly, don't disagree with you regarding. Would you agree with me that the current case management system in the legacy system is suboptimal, not functioning?
I would not agree that it's broken. I would agree that it's a car that's out of gas, that it doesn't have enough funding. And properly funded, there's nothing about the case management system that can't work. I've seen it with my own eyes when it's properly funded.
Do you believe there's any benefit for management of services and supports at the level of the community? You called it outsourcing, but this is really about re-engaging the community in the care of their children. And the state is impartial and partial third party, but maybe we need some partiality at the community level.
Well, we need passion at the community level, and I agree with you. And let me say, I have worked side by side with Wayne Carson for several years now on foster care redesign. I've been on the public-private partnership, and that is community-based, and we can do all of those things. The question is, are we going to take that final step and eliminate the public caseworker so that we don't have a public caseworker? Now, the public caseworker will be doing different things as redesign goes forward. Could quality assurance do it?
Quality assurance team, case reviews, case reads, and the state would retain representation in the courts under the bill.
So here's why that's not enough. But let me just say, we can get everything you want, Senator Schwartner, without giving up the public caseworker and signing off on case management. Why is quality assurance not enough? Because what's going to be left, the only way the state's going to be able to police these private contractors, and by the way, I ran a nonprofit. The nonprofit sector is wonderful, but you would be naive to think that there's not abuse and mismanagement and corruption in nonprofits, just like any place else.
It doesn't exist at the state level.
It does exist at the state level, and we do need to have oversight at the state level, but we don't want to give up public oversight of the nonprofit. So what kind of oversight do we have under Senate Bill 11? There's two kinds. Licensing, which is, are they meeting minimum standards? And quality assurance.
And contracting.
Which is, are they meeting the contracting standards? But the contracting standards won't say, do what's in the best interest of the child. You don't get that micro in the contract. You can't because of the capitation problem. They have to have that carefully drafted contract. They can't agree that they're going to do whatever that you say is in the best interest. They have to have specific things they're agreeing to do, and that's the only level at which you can hold them. You can't hold them to the individual case, micro decision of what's best for this child and this family with quality assurance. That's not what quality assurance does. The other thing to keep in mind about quality assurance is that quality assurance looks to see, are they meeting their performance-based standard benchmarks? Are they meeting their benchmarks? Well, they could be meeting their benchmarks, and if the benchmark is 10 people get open heart surgery in the hospital, and I'm the 11th guy who walks in and I need open heart surgery and I don't get it, that doesn't show up on quality assurance. That's just 10-10. You did great. So
speaking, I should never argue with much, but caseworkers right now are not necessarily incentivized to do what's in the best interest of the child. Right now, they're somewhat incentivized to close cases. You at least have the opportunity for improvement of the overall management of the child with a more coordinated, collaborative, community-based care system that allows for case management, not legal case management, but case management of certain types of services and supports at that level.
But see, what I want is my cake and eat it too. I want the best of both worlds. I want the careful kind of performance-based contracting with our service providers that you want, I want careful coordination of service delivery. I want a single plan of service for the child and family. I want everything Wayne said he wanted to do, and I want everything Wayne's done. I want all of that for the whole state. But that doesn't require me to give up a public caseworker who is there to oversee an individual case and say, you know, this nonprofit, as Andy said, they are favoring their own foster home that they've invested in. And the truth is, this child needs to go live with Aunt Sally. And we're going to take the legal position in the name of the state of Texas, exercising sovereign authority. I mean, you would be investing in a nonprofit, the sovereign authority of the state, to make this legal determination about what's best for the child.
Well, we're going to hear from other individuals that have a differing opinion.
And there are.
And
There are.
one other thing, the caseworkers and job security, there's preferential hiring parameters within the bill that would, the increased salary raises would transfer with them to for the caseworker work at the SSCC.
And
so
that-
there's been
That's in the committee substitute, and that was a very good provision, and I appreciate you adding it. It doesn't quite solve the problem, though. It'll mitigate it, but it won't quite solve it. And
why should we want an individual to stay just in, I mean, everybody should have the option and expectation of moving up in management and other areas of DFPS. We should not just tell them they're always going to be a caseworker. If they wanted to do something else, or they could be part of the quality assurance team, they could move to the SSCC. They have other
True.
options within the agency.
But the single biggest piece of the workforce are your caseworkers. And when you say all of the public caseworkers in the state of Texas are going to be let go, and instead they can either go work for a single source continuum.
Maybe they're excited to not to work for the state, but maybe to have an opportunity to do their job.
I don't think so. I think we did this in 2005 with Senate Bill 7, and the results were, we said we're going to outsource all of foster and adoptive development. We announced we were going to do that. All of our internal efforts immediately withered away, and our workforce left, and that's part of the reason we have the capacity crisis we have today, is of that effort. And so I think you're really going to, at the time we're trying to deal with this federal lawsuit, you're really going to be putting a kink in our ability to get our workforce stabilized and make improvements.
The court order looks toward this option as one potential avenue of improvement in foster care in Texas, and certainly in some of the results we've seen significant improvements, and I think we should continue to explore it. But I'm sorry, I don't want to hog all the time.
Senator Perry?
Real quick, you're one of the first judicial members that have graced the committee, not for lack of invite, but I would welcome a meeting with you if this is not the right forum. You heard my questioning earlier, I think, about an outdated family code that doesn't mirror the family unit our caseworkers deal today. So not today, not right now, but if you would like to have that discussion, maybe you see it working in your mind. I see frustrated caseworkers going through a legal system that they know up front there's an 18-month window. It's going to be repetitive. There's going to be another birth during that 18th month, and there's typically going to be just at the nick of time I comply, and then I get another 18 months on the next round of childbirth. So I would welcome opportunities for you to make a caseworker's life different through the family court system if you have those ideas.
I have two thoughts, but let me get to you offline, I think. Right.
Very well. Thank you, gentlemen.
Mr. Chairman.
Oh, I'm sorry. Senator Watson.
Yeah, I want to follow up on something that Dr. Carson said, and then part of an answer that you gave to the chairman. Are there things that we could do in the current system that would, let me back up, and I apologize, I'm kind of stuttering through this, but I want to explore this, because I see us as trying to explore ideas here. Dr. Carson more than once used the word efficiency, or at least that was my impression. You know, they can do it more efficiently. It may not cost any less, but we can do it more efficiently. Are there, and he talked at one point about redundancy. Are there things that we could do legislatively that would take some of the redundancy out of the system and make the legacy system work more efficiently?
Yes, and we're doing those in foster care redesign now, and we can do more. So, like Wayne Carson said, we can assign the responsibility to the single source continuum to develop the plan of service. We can have a single plan of service for the entire family. We can pay the single source continuum to work with the family, not just with the birth family, but with the kinship family. We can pay them to do that, and we can pay them to coordinate all of those services, and we can set performance-based benchmarks that encourage them and incentivize them to get good outcomes for the case. All of that can be done, but the question is, do we eliminate the public caseworker who looks over what our contractor is doing and says they're getting it right or they're getting it wrong? Now, it's no surprise to me that a contractor doesn't want any oversight. The fellow you hire to paint your house would rather you not have any say in anything to do with it, that you just pay the check. But that is not duplication. Oversight is not duplication. So having that public oversight is very important for the best interest of the child.
I've not been involved in the handling of any of these cases in the courtroom. And so the two of you, either one of you all might be the one to right answer this question for me. I note that Judge Jack in her order has indicated, one aspect of the order is to order that every case there be an attorney ad litem. Comment on.
So the United States Constitution does not require an attorney ad litem, and there are states that do not have an attorney ad litem. Federal law requires a guardian ad litem, but federal law does not require an attorney ad litem. Years ago, Texas got involved in some federal litigation, and we settled the case by promising to have an attorney ad litem up through when the department becomes permanent managing conservator.
Judge McCown, will you explain the difference between attorney ad litem and a guardian ad litem, please?
An attorney ad litem represents the child. He is the child's lawyer. The guardian ad litem is an independent voice who consults with the child and has a relationship with the child, but tells the court what in their opinion would be in the child's best interest. That's usually a lay person, and it's almost always CASA. And the attorney ad litem is the lawyer for the child. So in Texas, the child has a lawyer up until permanent managing conservatorship, which is not permanency. That's just when the state becomes a permanent managing conservator, no longer the temporary conservator. Now we still have to achieve permanency, adoption, a kinship home, whatever that's going to be. And Texas law does not require that the court have an attorney for the child at that point. Judge Jack says, yeah, you need to do that because these kids are getting so screwed up and screwed around, you need to have an attorney for them. So that's where we're at.
And Mr. Chairman, if I can, sometimes both the guardian ad litem and the attorney ad litem are dismissed at that point in the case. So, you have to go back, somebody has to go back before the judge if there's an issue and try and, get an order or something issued. The guardian ad litem usually doesn't have a legal standing. So this is another aspect of this where we need to make sure, and this is particularly in PMC where this occurs.
Right. And how, if you have an attorney ad litem beyond, how does that play out? How would that play out if you envision under Senate Bill 11? If you under Senate Bill 11, how would the requirement of an attorney ad litem impact?
So if if the legislature decides to transfer case management to Wayne Carson, then you definitely need to provide for an attorney ad litem for the life of the case, because that will at least strengthen oversight. But it's not public oversight.
I understand.
Can I?
And let me add one more thing, Judge, if I may.
Yeah.
And so the members understand. And the department has an attorney as well, which is typically the DA's office,
Right.
district attorney's office, or the county attorney.
Right. And could I say one more thing, because I just think it's so important for y'all to know? Each year, Texas removes about 2.4 children per 1,000 in our general population, brings them into care. That is extraordinarily low. We are the 43rd ranked state, so we have a very low removal rate. Florida annually removes 3.9 per 1,000 children, so a much higher removal rate. But this is the important point. Between 2012 and 2015, our removal rate increased only 1.2%. So our annual removal rate went up only 1.2%. Florida's annual removal rate during that same period, which corresponds to them getting rid of case management and going private, their removal rate went up almost 14%. So if you can imagine, you devolve all this down to the nonprofits, your removal rate goes up, anything like that, you have had a dramatic cost driver.
Judge, you know in Florida, local law enforcement does investigations and removal. It's not the single source continuum provider.
Right, and that's the issue.
So you're confounding them.
No, that's exactly my point. Right now in Texas, you've got investigations and conservatorship under the same management. And when you break that and you have investigations under one management and conservatorship under another, your investigations no longer has to worry about that kid or taking care of him. All they have to decide is, am I going to remove him? They have no responsibility. So if you're not responsible for the kid once he's in the house, and you're not responsible for getting the kid out the back door, then you're more free letting him in the front door. Removals go up.
Okay.
I'll explore that more, but
Yeah,
We're going to explore it more. Senator Colker.
yeah, let me see, and I'm just gonna hit on that point. So
Right.
you're saying that if investigations stay with CPS and they're placing them with the.
OCK, or single
Yes.
source continuum.
Yes, then the removals are gonna go up, whereas now they're connected and they're like, gosh, am I better off removing them from the home or in placing them where I'm not sure I have a foster home or not, or,
So let me explain why. And I'm not making this up. This is a recognized.
I would never think you
Well,
would.
it's just not me. This is a recognized phenomenon. People say this is what happens, a recognized phenomenon. Here's why. Let's say I'm an investigator, and I stumble across a teenager who's in trouble in a marginal home. And I think, well, I can take him over to Senator Watson's home, and he and his wonderful wife Liz will take care of him. I'm liable to, that's easy. I then have no risk. I remove him, I take him to Senator Watson, I'm done. Now, if I'm an investigator and I stumble across this troubled teenager in a marginal home, and I have to take him back to my house, where my wonderful wife, Mara, says, why are you bringing this kid in here, and how are we going to take care of him, and I have all those problems, then I'm not so quick to pick up. Instead, what I do is I figure out, can we get some services in the home? Can we line up big brothers, big sisters? Can we somehow help the child maintain in that home? You shift the incentives.
But Judge, what's the best decision there? So,
Well, the best-
it's the trouble of bringing them to my house, or is it really better that the child's at the Watsons? And so,
So for some kids, it may be better that the child's at the Watsons, but for most kids, it's going to be better to stay with services in the home.
Judge, I just
Senator
to completely clarify, I'm not doing anything regarding, judges still order removals. It's not the state, nor is it SSCCs or investigators or law enforcement.
No, what you're doing is you are taking the management, right now, investigations and conservatorship are together,
They still are. The state still has responsibility for
but it has
conservatorship.
no managers. They just,
It has ultimate responsibility still.
but no managers, and it all
Yeah.
devolves down to the single source continuum.
The management of the case for the best provision for that child are coordinated at the community level under this bill, but the ultimate responsibility for both investigations and conservatorship under this bill reside with the state.
Right, but the management is split, and that's the point I'm making.
And maybe we should split the case management functions that are ones regarding services and supports that are best decided in a collaborative manner with the community single source continuing contractor, and allow the case management functions that are legal to remain appropriately with the state.
I would take that deal.
Will you just want to sign on my bill?
Mr. Chairman, we're making
And this has nothing to do with changing the burden of proof for removals and our
No.
judges and how they remove children. I don't want anyone on this dais thinking that this is somehow going to increase removal rates of children from homes, because it's quite simply not true.
Well, I don't agree. I think experience has shown it will, and this is a recognized phenomenon for the reasons I explained, so.
Back to Senator Coker.
Yeah, I just, I appreciate the exchange, and Mr. Chairman, your willingness to listen through. You said something about, you know.
He's a good adversary, isn't he?
Once you make all these changes, and, you know, I had some experience when we privatized prisons, and I had the same fears of, man, when we get rid of all the prisons, all of a sudden, you know, like, what if we have to relapse back to it? And there's a mix there that I thought was very healthy. So I'm going to ask this question, maybe of the chairman, maybe I didn't. I'm parsing through all these notes again. We're not saying that this is the model that's going to be everywhere in the state of Texas, because I don't know that it's going to work everywhere in the state of Texas. Okay?
Well, and I want to commend Senator Schwartner for another provision in his bill, which he has a very thorough readiness review before it rolls forward.
I am rightly concerned, as you are, Senator, that community-based foster care is, you got to have the resources, you have to have the community involvement, you got to have the leadership in the community to do this right. It is not just a matter of funding. And so
That's correct.
that's why the readiness review is in this bill. I think there are significant metropolitan areas that would benefit from this if they were allowed to free themselves from the shackles of how we do it in the state of Texas currently, and to move forward and make novel innovations and allow for those children to be taken care of in a way that is best for them, with individuals that are connected to them from a geographic standpoint, from a from a faith-based or a not-for-profit standpoint. I think we need to move outside some of the historical protected lines of thinking here at the Capitol and give this a chance.
I get you on that, and I think that, Judge, you know, I probably represented in one CASA division, I don't think we had one foster home, not one. And I'm talking Waller County, Washington County, Austin County, Fayette County. I mean, smaller communities that knew the community. Nobody was willing to step up. And so we do have to innovate in a way. And I know the faith-based community is entering in, and we're pleading to them to make this an awareness thing. So I think that some of this combination of what I'm hearing. The one last thing I'm going to follow up. You keep saying, but we need that case manager from the state that has the best interest of the child at heart. Now, I would like to say that I think that public-private partnerships with correct language and correctly hired, the tests that we'll have in place, they'll still care about that child. So you're saying just keep every caseworker and let's do redesign, or?
Well, we don't necessarily have to have the same caseload for the caseworker in this redesigned system I'm imagining. So you may have fewer public caseworkers, they may have larger caseloads because they're doing a different kind of work. But you would have a public caseworker for every child. You might have fewer caseworkers overall, and you would have somebody in the single source continuum doing the service coordination, developing the plans, working with the children, working with the family, doing the service coordination. And you might say, well, why have that money? Well, why spend that money? Because you want that public oversight. The other thing you want, Senator Colcourse, that I think your example hits on really well, is that when a private provider walks away like Providence did, or when a private provider goes under and goes belly up for whatever financial reason, you need to have a public infrastructure that sits on top that can keep those cases moving and that can go down and take over that management until you get another contract in place. Having the ability to do that public casework gives you that backup. It is a redundancy, but redundancy can be a good thing. It gives you that backup. It also gives you the ability to negotiate price. Because then if the private providers are trying to hold you up on rates, You've got a public workforce. You can expand and do the work yourself. You're a competitor.
Which I always argued about with private prisons and having that healthy tension there to try to get the best price.
Exactly.
There is a need for healthy tension, but I'm a little nervous about not only duplicative efforts, but when we have this private partner, I don't also want to quell their innovativeness. And it tends to be, Judge, what I have found is that government does not innovate well. And I don't know why. We can go and there's studies and stuff, but we don't innovate well. We don't move in that space well. And so when we tend to have too many government workers over a highway contract, it costs us more, and we don't end up with always necessarily a better product. And I don't want to say children or highways. I'm just using examples of quelling innovation.
And that's why foster care redesign is so great, because we're getting tremendous innovation, we're getting the community-based approach, but you still don't want to give up that public oversight. You would not want your health care to be managed by a managed health care system that you didn't have oversight over and that you had no say on what happened. And that's the same for the state.
We have a quality assurance division that's put in place. We have contractual relationships envisioned under this bill. I just want to point out that there have been a number of reports that highlighted the duplication of efforts. The Stephen Group did, a study released by the department did, between case managers, not just at the state level and at the SSCC level, but also within managed care and their case management functions and CPA. So there's a whole lot of case managers making lots of plans, and sometimes they are all in the best interest. Sometimes they compete against each other.
I think that's right, and I agree with you that we need to squeeze that duplication out. But bottom line, oversight, public oversight, I don't think is duplication.
We are not giving up public oversight of conservatorship. It remains with the state.
Senator,
Thank you. I will beat this
Senator
horse
Watson.
quite a bit.
One quick statement about the colloquy between the chairman and Senator Colcourse. It's clear that the conversation has to also include ways to improve the legacy system. And we can't, so as we engage in this and get our fingers dirty and try to wrap our hands around it, we can't just look at it in one way, because regardless of where we go, we're going to need to make improvement in the legacy system.
I agree with you completely. We need to have a vision for where we want to go. First of all, what is the best system to take care of foster children and get them in a safe and caring environment, and then toward permanency of some sort, with the eye to improving the legacy system. It's a complex task.
Okay, any other questions of these gentlemen?
Thank you, Judge, for coming.
All right,
Thank you all
thank
very
you all.
much.